Dr. Sean Riley from Tulsa Spine and Rehab often refers to the clinical toolbox available at his clinic. That's his way of describing the variety of treatment options available from the diverse practitioners on staff at the clinic. Today, we visit with Ryan Smith, a physical therapist on staff at Tulsa Spine and Rehab, and we learn about the benefit amateur athletes can receive from physical therapy. One of the cool things about Tulsa Spine and Rehab is that you have different practitioners there and different specialties, different treatment options available to patients. Tell us about your role as a physical therapist at Tulsa Spine and Rehab.
Well, I'm the director of physical therapy here at Tulsa Spine and Rehab, and my goal is to make sure that from a physical therapy staff standpoint, everybody's has all the tools that they need to deliver great care. And specifically to me, I focus on sports and orthopedic injuries. So sprains, strains, fractures, surgeries, and specifically some of the areas that I really enjoy working with are some of the more technical injuries like a tendon injury or what we call a joint surface injury, which is where the cartilage in the knee or a shoulder or a hip is injured. And then certainly enjoy seeing athletes of all levels. When I think of athletes, I don't think of somebody who is just like the classic NFL or collegiate player. I'm more interested in somebody who's trying to get back to something. So that could be whether somebody trying to run a 5K again, or it could be, a grandparent wanting to play with their kids or their grandkids. Those are the things that I'm really focused on is sports and orthopedic injuries and specifically some of those other areas that I highlighted.
You talked about great care as being one of your goals. What's your definition of great care?
Well, I think it's a multifaceted issue. And so it's not just about, say, knowing what's wrong with somebody. I think it's also being in touch with that person. And that's one of the things we often talk about in here is that people often don't want to just be touched, say, from a manual therapy standpoint, but they actually want you to be in touch with them. And I think that that's what's really important is to get that connection on the front end with a client and make sure you're really clear on what it is that they're trying to achieve. I think it's easy as a practitioner sometimes to get so focused on trying to get the right answer and, prove to somebody else that you know what's wrong, as opposed to really listening to the client and understand what their hopes are, what their fears are, and what it is they're truly wanting to get back to. And also, I think being clear on what their personal preferences are on how to get there.
What attracted you to physical therapy in the first place?
Well, I think like a lot of physical therapists or chiropractors or medical folks, I got hurt. So I played a lot of sports growing up and spent a lot of time in rehab. And specifically, I was playing football in high school and ended up damaging my left knee and spent quite a few months in rehab and decided this was pretty cool. This is something I might really like to do. And so as I got into college, I spent quite a bit of time in some different rehab facilities and with physical therapists that I felt were really good at what they did. And I realized it was something that I really wanted to do. And so it was really something I wanted to do as soon as I got into college. I was either going to be that or med school. And it was pretty clear to me from the beginning that physical therapy was going to be a good fit for me.
You describe a passion that you have for what I'll call weekend warriors. And sometimes practitioners, or maybe we use that as a degrading term, that sort of thing, but you like working with them. You like helping them reach their goals?
Yeah, I really do. And I agree with you. I think a lot of times that is sometimes comes across as a negative, but I think it's great. I think as long as people are wise in what they're going after, but folks that stay active are the folks who tend to age more gracefully, in my opinion. And after doing this now for 17 plus years, the people who stay active and stay pursuing new and different things are the ones who tend to feel better as they age. And I think that's what we all want. I mean, everybody's going to get older, but I think we want to feel young as we age. And I think staying active and pursuing things, both physical things, mental things, emotional things, and being pushed is a good thing. Now, I do think that we have quite a few clients that need quite a bit of training to help them make better choices in the way that they train. And a lot of times we'll discover in those discussions that they're maybe chasing something that that perhaps they don't even realize. So for instance, they may be running 30 miles a week, and that's really because they're really unhappy in another part of their life. And sometimes we kind of help them discover that along the way. I know that sounds a little heavy, but we all make decisions for a reason.
So it's about understanding the motivations, but then once they start doing it, also helping identify techniques that may or may not be helpful and may be hurting them in the long run.
Absolutely. So I think that's one of the big things is to get, clear on what it is they want to go back to and putting together a clear roadmap on how they can achieve their goal. And a lot of times that means we have to alter the time frame for them because because in our mind, we're all 18 to 21 years old a lot of times. They're like, I ran a 5K before, I can do this. But, in the past, maybe you could train for a month and you would be fine. Now it may take 6 months. And so helping people understand that roadmap and give reasonable expectations and give them a coach and give them some guidelines, we find if we do that and we work together as a team, then the outcomes for those clients are much better.
Tulsa Spine and Rehab has a variety of treatment options available to help you. Call them today to see how they can help. 918-743-3737.